If you want to make a difference in healthcare, I think it's important to learn all aspects.
There's a lot of problems in the healthcare industry.
For a lot of us who work in healthcare, either from a clinical side or from a business side, to really think about what we can really do to improve the healthcare system.
You can get an MBA anywhere and you can learn business analytics anywhere, but what we do is we really translate that so that clinicians in healthcare can really use it in their settings.
Our goal was really to build a data dashboard that allows ongoing tracking, assessment around cost metrics and outcome metrics.
We've done data analysis on the types of patients and the problems of patients that come in and die in our hospital.
So I picked up a subject about a device called Red Vest that is used for monitoring of patients with heart failure.
Expanding the conversation among physicians at a hospital.
A model for oncology bundle payments.
We're creating a real-life proposal that we're going to give to a real client, and the coursework and the expertise that we gleaned from our professors actually helped us build out a really robust proposal that we're going to deliver in the real world.
These are research projects. This is something that they want to do in their organization. Healthcare has really become something of a business.
You know, you have to do medical school, you have to do clinical rotations, you have to do residency. And so while you're very strong in medicine and knowing what you're doing, the system and hospitals and administration is something that you never learn.
Business analytics, microeconomics, insurance reimbursement.
Discussions of the patient experience, discussions of how do you improve clinical care delivery models, and really how do you evolve how we deliver care.
All those kinds of things are really driving practice.
The Katz MBA program is a blended online and also in-class experience that's an MBA in healthcare that's laying the groundwork to transition our lives into a workforce that can change healthcare.
With a healthcare MBA, I feel like you have very different paths that you could choose. If you are not involved, you don't have a voice, and that voice is important, not only for patient care, but for the future of the hospital itself.
The program provides a deeper understanding and just education around how care is delivered here in the U.S., but also a global understanding.
The faculty here are second to none. They are very accomplished in their fields and they're extremely professional, and that's been their interaction with our group from the get-go.
It isn't as much as a student-professor relationship and more of a conversation between colleagues.
A number of individuals from different backgrounds, from individuals who are physicians to those who work for medical device companies and also those who work for entrepreneurial startups.
They become your friends, they become your family, you engage with them, and you build another set of friends.
That really added to a very robust discussion.
We put a lot of thought into designing this program. Students come in once a month. They have 2 intensive days once a month in classes, and then we have a third of the program they do through distance learning.
It's geared toward students in my position who work most of the time 60, 70 hours a week. They really don't have time to engage in a traditional program.
I just did not know what I didn't know. And I'll tell you what, this program has really helped uncover those rocks and really open my eyes to a lot of other possibilities.
For those who may have the opportunity or interest in taking advantage of something like this, I would encourage them to do so.